I am the Managing Director of Megascope Healthcare Kenya Limited.
Good evening.
My name is Dorothy Akello. I work for Megascope Healthcare as the Chief Administrator.
One of the subjects which involved the Jack Ma Foundation COVID-19 supplies, clearance, and supply of other COVID-19 related items. And therefore, on invitation through the chair of this Honorable Departmental Committee of Health, we are here to respond on the allegations that have maliciously dragged Megascope Healthcare Kenya Limited name into the alleged disappearance of Jack Ma Foundation donation to Kenya. So the invitation we received indicated that your committee is aware that our company was appointed and authorized by KEMSA to clear the Jack Ma's consignment for Jomo Kenyatta International Airport. But I am glad, Madam Chair, because you have corrected and you have actually confirmed it was erroneous in your invitation. It should not have read aware. Therefore, we wish to introduce Megascope Healthcare Kenya Limited as a supplier and distributor of medical equipment and hospital disposables since its inception in the year 2002. Megascope Healthcare Kenya Limited has gained unmatched reputation for our knowledge of vital hospital equipment used.
What is out of order?
Actually, there's nothing out of order, but I'm seeking your directions. You've just been served with a document which is a notice of motion, and at the end of it, I've seen a ruling by Duranera J admitting this matter for hearing. Interparties, I think, on for directions on 10th of September. Madam Chair, going by the letter that the clerk sent to Megascope to appear before us and shed light on matters of Jack Ma equipment clearance or clearing, and on a casual perusal, Madam Chair, of the notice of motion and the grounds thereto.
Which notice are you referring to?
Notice of motion, Madam Chair, a court document. It is a civil suit number E094 of 2020.
Okay.
At Milimani Law Court, Civil Division. So, Madam Chair, on a casual perusal of the grounds in support of this notice of motion, it's very clear that what Megascope is here, what we have called them here to come and shed light on, is actually again being arbitrated to at the High Court. So, Madam Chair, with your kind permission, I would wish to refer you and this committee to the ruling that was delivered by the Honorable Speaker a while back. A minute, Madam Chair. The ruling that was delivered by Honorable Justin Muturi about a similar matter, that a petition that had been, I wish Moyondi would let me discuss with Madam Chair or put my points across without interference. A ruling that was delivered by Honorable Justin Bidan Muturi a while back in a normal similar matter, that was there was a civil appeal number 33 of 2016, being a Commission of Custom Services versus Bidco Oil Refineries Limited. A matter had been referred to the Labour Committee, and an issue of sub judice was raised. And the Speaker was very clear and categorical. You may discuss, the Committee of Labour may discuss any matter that had been referred by Honorable Judy Jomo to the Labour Committee. Safe, and mark my words, you should not discuss matters that will be canvassed in court, so that this Parliament or its committee seeking the direction.
point, yes.
I am to lay down the basis of my, for you to make a ruling, Madam Chair.
Yes, proceed.
Having those, if we were to discuss, if we were to sit as this committee and discuss these matters, which are already again in court, we'll be guilty of the rule of sub judice. Now, is it fair for us as a committee to discuss that matter, which is again being canvassed at the High Court?
I think, Honorable Jagagun, we've already had an earlier submission, and this matter we have discussed a lot even today, even when the ministry came. It's a matter of public interest. We are the people's representative. We are not here to make a ruling. And there is a submission, and that's why I told and asked the person presenting from Megascope to just go straight to the point. The question was, did you not supply, were you involved in the clearance? And I think with the Crown Health, it was very clear. That doesn't stop us, because we're not here to make a ruling now. And after that, we as a committee will sit, we'll have to table a report to Parliament. But the fact that your case is in court doesn't stop us from asking, and doesn't stop the public from asking those hard questions.
Chair, may I add my voice here? Megascope, you have an opportunity. You either take it or leave it.
Madam Chair, I think let me just continue with my presentation. But I've noted your concerns, and I've noted the concern of my legal counsel, Najaroge Ngero. So it is also important, honorable committee members, through the chair, that the same members, the public, should be able to know who this Megascope Kenya, Healthcare Kenya Limited is. And it is good just to introduce ourselves as a supplier of medical equipment and hospital disposable since the year 2002, like I had mentioned earlier. And Megascope Healthcare Kenya Limited has gained and marked a reputation for our knowledge for vital hospital equipment used in critical care and anesthesia machines, radiology, central sterilization units, ophthalmology, dentistry, laboratory, physiotherapy, and electrotherapy equipment, to name but a few. So just to mention also a few of our customers, who include also KEMSA, is the government public hospitals, some of which are Kenyatta National Hospital, Moi Teaching and Referral Hospital, Jomo Kenyatta University Hospital, Ministry of Health, and also the private hospitals as well. Namely, we do have, and we do also supply to Aga Khan University Hospital. We also engage with the Kenya Red Cross, Medical Essential Supplies, who are MEDS, African Development Bank, Ministry of Education, Nairobi Hospital, Mata Hospital, Gertrude's Children's Hospital, St. Mary's Mission Hospital, Elgon View Hospitals. If I continue, then we shall leave here in the next 3 to 4 hours. So I want to say that besides the above-mentioned institutions, we also sell to private retailers as well across these counties of this country, beautiful country, Kenya. And our scope of business and operations has witnessed exponential growth from distribution of medical equipment to capacity building, with an objective to see that those in the medical fraternity, specifically biomedical engineers, become more adept in their skills. We, as Megascope Healthcare, have an already confirmed training center. This training center has also been is a center of excellence for both East and Central Africa, where we do train these biomedical engineers, radiographers, radiologists, and they come for this capacity building. So Megascope has also partnered with globally renowned brands such as Mindray Shenzhen in China, Neosoft Medical Systems in China, Tutnauer in Israel, Carvo Dental in Germany, Stefanix in France, Ahmed in China, and many other companies including US, UK, Europe, South Africa, Turkey, and also Pakistan. I would now wish to respond just to raise concerns on the question of the JACMA issues, and we wish to be very categorical and clarify that Megascope Healthcare Kenya Limited has never been registered as a clearing agent. I want to repeat that. Megascope Healthcare Kenya Limited has never been registered as a clearing agent of any sort, and as such does not have the mandate to clear any consignments. Further, Megascope Healthcare Kenya Limited has never been engaged by any government agency nor KEMSA to clear any COVID-19 related consignments, including the donations from Jack Ma. Be therefore informed that we did not clear the Jack Ma donated COVID-19 cargo, and therefore have no further statement to this, as we are pursuing the matter through the court of law, as it has been alluded by our counsel, the lawyer, Droge Migero, and I'm here by my legal counsel to confirm the same, that the answer is no, we did not clear. I do want to also respond to your second question, which you asked a detailed report on what Megascope Healthcare Kenya Limited supplied to KEMSA since March 2020 and what was the procurement process undertaken. Megascope Healthcare Kenya Limited has been a supplier again since the year I mentioned, and we have grown in our client base, being a reliable supplier of quality healthcare products, of medical equipment in Kenya, and also providing solutions and turnkey projects. Among our clients is the Kenya Medical Supplies Authority, that is KEMSA, that upon detection of the first case of COVID-19 in Kenya on 12th March of 2020, our clients in healthcare industry started their preparedness to ensure infection prevention and readiness to attend to patients with COVID-19. And among the preparedness was the urgent procurement of personal protective equipment that include coveralls with shoe covers, medical goggles, KN95, face masks, natural gloves, and face shields as well, and not forgetting ventilators. The items were sourced both as separate items and as a complete kit. The nature of items have not been regular medical supplies, led to KEMSA seeking samples from various suppliers, and in this case, Megascope Healthcare Kenya Limited, which was contacted by KEMSA requesting submission of any samples that were available for quality checks to enable KEMSA determine if they would meet the specifications that guided quality assurance. And upon quality checks of the samples and sample acceptance, we were issued with a commitment letter dated 17th March 2019, asking us to deliver available quantities on delivery notes. We were also issued with a pre-inspection quality report of PPE kits that confirmed the samples we submitted of various PPEs were acceptable. We also received a distress call on urgent need for a ventilator to rescue a patient who had been admitted in Msambweni Level 5 Hospital on 23rd March 2020 with COVID-19 and was getting respiratory distress. On this, we had an available unit of a ventilator, and given the life-saving nature of the need, we were tasked to deliver the ventilator via flight to Msambweni to rescue the patient from distress call. Honorable Chair, I'm trying to demonstrate that we as Megascope Healthcare fraternity put our lives on the line to try and save lives in this country. The said ventilator was dispatched under delivery note number 22119 on the procurement process followed in supply of COVID-19 items to KEMSA. Upon establishing that we had the capacity to deliver on the COVID-19 related items, which we had communicated to KEMSA through samples submission, the direct procurement process was followed, and this is the chronology of events I just want to take you through, Madam Chair. One is the letter of intent to supply at the stated selling prices, which is, of course, in one of the submissions. Commitment letter to supply urgently required items specifying the quantity and delivery timeline. Number 3 was we delivered on delivery notes. And 4 was upon completion of delivery, we received invitation to tender for supplied goods. We then, number 5 is tender bids were submitted and negotiations were conducted by KEMSA, which are also minuted. Number 6 was award notification indicating negotiated prices that were issued, and letter of acceptance was issued in responses to the award notification. We were issued with contracts that we signed at the time for each awarded tender. And the number 9 is local purchase order against each tender was also issued. Number 10, invoice to KEMSA was generated and submitted to them. Payment advice was to be issued to us on every outstanding payment. Number 12 is for items required after sales support. We follow up ensuring we install, commission, and also train the users on usage of equipment, including wearing the PPE kits. The COVID-19 pandemic brought about disruption of business and by extension the supply chain. So given that the items required were not regular supplies, we had to source all our supplies from China, who are the main global suppliers. And because the rule of demand and supply, production of items was hampered by safety measures, regulation, and only a few manufacturers were left in production. Global lockdown rendered limited air transportation. And accordingly, both the manufacturers and airlines adjusted their prices upwards. Of importance to note is the cost of air freight increased from $10 per kilo to $29 per kilo. One, medical supplies. We have delivered COVID-related items as per the commitment letters and contracted signed. We wish to clarify that the following receipt of commitment letters that indicated quantities to deliver, Megascope Healthcare Kenya Limited pursued among the long-term overseas suppliers to determine who among them was able to supply an urgency on urgency basis. And therefore, Megascope Healthcare Kenya Limited settled on a non-medical company limited who had the items we needed available, albeit in piecemeal, due to the global shortage of both raw material and finished goods coupled with a spike in demand for COVID-19 related items, especially PPEs. We further liaised with our other OEMs for supply of ventilators, and upon receipt of commitment letters, we immediately embarked on importation, which entails application of importation documents through the oversight authorities. Given the nature of the urgency, we were compelled to use the fastest available means to ship the consignments through chartered aircrafts and fastest direct flights. However, it's important to note that the consignments were shipped, airlifted, and delivered as the contractual obligation. And upon arrival, all shipments were delivered to our warehouses for quality checks, analysis, before delivery to KEMSA. Though we have fully complied and delivered on some of the commitments, Megascope Healthcare has not been paid to date. The delay in payment is a constraint to our cash flow and as such has affected our operations. We would like to bring to the attention of this Honorable Health Committee that we were not only selling to KEMSA, but to private market as well. Just to name a few, we also supplied PPE kits to Nairobi Hospital at the same prices and some even above the prices of KEMSA. In fact, it took us a long time to agree to supply KEMSA because of the constraint of prices at the time. We also supplied the Aga Khan University Hospital and also MEDS, who is the Mission for Essential Drugs and Supplies. So they also bought supplies from us as well. We did also supply to AMREF as well. And to date, we still sell ventilators, we still sell beds and COVID-related items to most of the counties and the private hospitals in this country. Madam Chair, it is my duty now to request this honorable committee, because Megascope Healthcare Kenya Limited has been adversely mentioned, among few companies, about 8 in total, 12 companies. It is well to my knowledge, Madam Chair, that we have more than 60 companies, if not 100, that participated in tender at KEMSA during this COVID-19 pandemic. And to date, we still don't know the list of those companies, but we know the list of 8 companies. I would want, Madam Chair, because we are here, if it is possible, that we could also be able to know who are these other suppliers. We do know them. We know that they are able. We know that they are competent. But why single out on 8 or 12 companies? We want to know what kind of witch hunt that is there. And earlier I spoke, and I'm speaking now as a private a businessman, that today we are hurting not only established businesses, but also, remember, this COVID-19 is still with us. Today we know the government of Kenya is seeking to get some vaccines. I am sure, double sure, that the government does not do business. Where do you expect to buy these commodities, the vaccine? Isn't it the same companies you criminalize out here that they are criminals and they're dealing with scandalous processes? These are the same companies you will come to at the time, the hour of need. And therefore, Madam Chair, I would want your protection from this Honorable Committee and also to the National Assembly to protect the private sector, to prevent businesses. I will tell you for a fact that today, any country, any foreign country will not be willing at the moment to come and invest here. It has been a huge fight for us, those companies that we have partnered with them, to try and invite them so that we can come and also pitch tent in terms of manufacturing of medical devices and also in terms of making sure that we have plants that can also be able to generate equipment for the region. It has become that difficult, Madam Chair. So for me, I do want, before I submit, to also ask our General Manager, Reni Rupalo, also to support my argument if he has any.
Madam Chair and honourable members, we are here in response to your invitation dated 1st of September 2020, reference NA DCS Health / 2020-081, requiring us to appear before you and make submissions on the following 2 issues. Firstly, the role played by our company, Crown Healthcare, in clearing the Jack Ma Foundation COVID-19 supplies from Jomo Kenyatta International Airport. And 2, a detailed report on what our company, Crown Healthcare, supplied to KEMSA since March 2020 and what is the procurement process undertaken. I'd firstly like to give you a bit of a background on Crown Healthcare. Crown Healthcare has been in the business of provision of total hospital solutions, namely supply of medical, laboratory equipment, and pharmaceuticals since 1998.
Sorry to interfere, but I would like you properly wear your mask. You properly wear your mask. Just pull up your mask.
Thank you.
Thank you. Proceed.
And therefore, with experience, expertise, and the capacity spanning for more than 20 years. I'd like to state at this juncture that we also have a team of more than 350. Madam Chair, it'll pleasantly surprise you to learn that some of your current members are former sales reps of the company. We have been in this business for long enough. This is not our first business. Our major clientele is mainly the private and the mission sector, with minimal supplies to government institutions. Madam Chair Lady and honourable members, we are pleased to make the following submissions in response to the 2 issues raised in your letter as follows. Firstly, the alleged role in the purported clearance of the COVID-19 Jack Ma Foundation donations. Madam Chair, honourable members, the allegation that our company were involved in the clearing or in any way handling the Jack Ma Foundations is false and defamatory against us as a company. We totally reject and refute the allegations leveled against our reputable company as utter falsehoods without any factual...
Madam Chair, sorry to interrupt the gentleman as he's making his presentation.
And also properly put on your
I would
mask.
seek
Honorable Chagagwa.
I would seek your directions.
Yes.
We were here yesterday when we invited the CS,
Yes.
Minister of Transport. He was not able to attend in person, and he sent the cars, Honorable Senator Klizobure, this morning, who actually clarified that all the Jack Ma items, donations, equipment, name it, are actually cleared by a government agency. The letter that you've read out to the parties is to the effect that there were allegations, or maybe rumors, but the chair was very candid, there were allegations. Now, if we were certain, and the CAS was able to explain to this committee and to Kenyans that the goods were actually cleared by a government agency, Madam Chair, is there any need of us to sit here to interrogate that statement, and they are just rumors, just allegations?
Honorable Chagagwa.
We do not, sorry Madam Chair to interrupt you, but Parliament should not legislate or seem to work in vain. That point was explained, and there was not a single item that we were told was cleared by Megascope or the other companies.
Honorable Chagagwa, you'll allow, all these letters went out at the same time,
Yes.
including the clarification that you are alluding to. And so since I've seen the explanation is long, let them just finish for the purposes of records that also the companies came and appeared before us. And I've seen how he's going, it's just summarized. Let him finalize.
Okay,
It's
maybe
actually 2 or 3 statements. Now, if you didn't interrupt, you'll be done with
Madam
that
Chair,
matter.
I'm saving you time and this committee time.
You are now wasting
The
more.
company
We're
is
wasting more
represented.
time here.
The company is
Exactly.
represented
We are
by
wasting more
It's all right,
Council.
Honorable Chagagwa, let him proceed and finish so that it goes on record.
A single word would say we never cleared and we are done.
Honorable Chagagwa, allow him just to proceed. Proceed.
So we've totally rejected and refute the allegations leveled against our reputable company as utter falsehoods and without any factual basis. As a matter of fact, we have instituted legal action against the media, against Nation Media House and individuals that published and disseminated this outrageous allegations in the first instance in a purported expose aired in local TV. Copies of the legal complaints are enclosed in the documents submitted to this committee. For the record and clarity, we wish to say this as follows. Our company is not in the logistics, clearing and forwarding industry as alleged or at all. Our company was not involved in the alleged clearing of the Jack Ma Foundation donations as alleged or in any matter whatsoever. Our company was not and has never been involved in the clearance of any consignment and donations on behalf of KEMSA or, for that matter, any other entity whatsoever. The allegations against our company are unfortunate, false, and malicious. This is all we have to say in response to the allegations on clearing of the Jack Ma Foundation COVID-19 donations before this honorable committee. Madam Chair and honorable members, I will go on to the next question.
Proceed.
Which was particulars of our company's supplies to KEMSA as from March 2020. I would like to categorically state that we have not, as Crown Healthcare, supplied any PPE to KEMSA. Madam Chair, however, since March 2020, our company have supplied COVID-19 pandemic interventions under the following contracts, whose particulars are as follows. Tender number KEMSA DP 25-219-2020, supply of ventilators valued at 12 million shillings. tender number KEMSA DP 73 2019-2020 supply of sterile gloves, surgical, valued at approximately 38 million shillings. Again, all documentations have been submitted to this committee. As I mentioned, we have prepared a detailed submission of both the tenders for your reference. Compliance with legal provisions. Madam Chair and honorable members, first and foremost, we state that our dealings with KEMSA in discharge of the aforementioned contracts were in compliance and in adherence to the express and implied provisions and principles of Article 227 of the Constitution, which provides that when a state organ or any other public entity contracts for goods or services, it shall do so in a manner that is transparent, competitive, and cost-effective. We do confirm and has demonstrated in our submissions that our prices for all the items supplied were indeed competitive and at the prevailing market prices, and thus in compliance with the constitutional requirements. I may add that the surgical sterile gloves have actually indeed increased in price since the supply was made. We confirm that our dealings with KEMSA have been in strict compliance with the procurement provisions on our capacity, qualifications, and eligibility to submit bids by dint of. We are duly eligible to submit bids before a procurement entity in accordance with Section 55 PPDA. We have not engaged in any inappropriate influence or corrupt practices as spelled out under Section 65 and 66 of the PPDA, which would render us ineligible to bid. We have not been debarred from participating in any procurement proceedings as provided by Part 4, in particular Section 41 of PPDA Act. And lastly, all our quoted prices are based on competitive and fair market prices. The procurement process. Madam Chair, you are aware that His Excellency the President, by virtue of the Executive Order 2 of 2020, issued on the 28th February 2020, declared COVID-19 a national pandemic. Based on what we were convicted of the fact that any emergency procurement related to COVID-19 would not follow the normal procurement process, as it would be about saving lives. In participation of such procurement, we satisfied all criteria under provisions of Section 91, 92, 103 of the PPDA Act in relation to direct procurement legally recognized as an alternative method of procurement. We would further like to state as follows, that there was an urgent need for the government to procure various medical items in light of the COVID-19 pandemic, and we had the capacity and expertise to meet such needs. Our company is one of the few well-known reputable medical suppliers in the industry and in the region, as previously stated, having provided medical equipment and solutions to clients for more than 20 years. We have maintained a reputation of supplying quality medical equipment, consumables at fair prices within the market. We were probably one of the few companies that were able to supply ventilators and gloves and had those stocks in the country at that time. From our submissions, the committee will note that the ventilators and gloves supplied to KEMSA were part of the consignment of assorted medical items which we had already imported in October 2019. All the documentations are in this submission. Our prices were competitive and comparative to the market prices. Indeed, we have, as part of our submissions, provided documentation of similar supplies to private hospitals around the same period. In fact, This morning, we have again supplied a similar model of ventilator supplied to KEMSA to a private entity at the same price. I state again, all the documentations have been provided. On the gloves, we have similarly provided documents to show that the prices around the same period supplied to private entities were competitive to the prices quoted to KEMSA. The current prices of this commodity are still rising. The lead time for delivery has gone up from 30 to 300 days. It is imperative for the record for the committee to note that we are duly registered and licensed by the Pharmacy and Poisons Board to import and supply medical devices and consumables. Documents to support the same are duly enclosed in our submissions on the two items that we have supplied to KEMSA. We have the production registration certificates duly issued as follows. For the ventilators, Pharmacy and Poisons Board registration number 14 issued on the 6th of June 2019 and expiring on the 31st of December 2020. Secondly, for the sterile surgical gloves, Pharmacy and Poisons Board registration number 1826 issued on the 13th of November 2019, expiring on the 31st of December 2020. Clearly, from the foregoing, the committee can take note of the fact that we did not premeditate to benefit in any way from the COVID-19 pandemic, as this is our normal course of business. In fact, we played our role of assisting to respond to the emergency as we would have sold the same items in the open market at the same prices and without the resultant delays in payment and attendant inconveniences. We supply quality certified items, installed and commissioned the ventilators at the Ngatia National Hospital, and we further went ahead to train as many users possible on the use of this equipment. In our submission, we have provided the installation job cards, photos of the actual training of the medical personnel, a schedule of the names and designations of the personnel trained. The committee should take note that the supply and the installation of this life-saving equipment was done at the peak of the pandemic, and we are sure, due to our timely intervention, we played a part in saving numerous lives of our fellow citizens. Madam Chair, as it now stands, despite having supplied the equipment to KEMSA, installing and servicing the ventilators, our company has still yet to be paid by KEMSA. The comparative invoices provided in relation to the private sector supplies have all been duly settled. We fully support the probe of this committee and any other investigative agencies. We implore on this honorable committee to get to the bottom of the matter and leave no stone unturned in establishing the truth. It will be instructive for the source of these allegations to table any documentary evidence they may have to this honorable committee. Thank you, Madam Chair and honorable members, for giving us the opportunity to set the record straight and to enable us to table the facts as they are in relation to Crown Healthcare Limited. Thank you.
Entrepreneurs are criminalized. We do have so many companies in this country and foreign companies working in this country. We have never had one being criminalized. But on the same tender, you hear the local company has been brought down by either those people who have certain issues or who actually have some grievances. So we are requesting that this committee to intervene and see it that we have a conducive environment. That was all, Madam Chair.
Thank you.